Okay. Hello, everyone. This is the Countdown to 2030 webinar on the countdown profiles. And we're going to give it like a minute or so for some more people to join, as I can see that the numbers are ticking. So let's just give it 1 minute for people to join, and we start right away because we have a lot on our agenda today. So I think we're going to get started. So thanks everyone for joining this Countdown to 2030 Profiles webinar on using data to improve women's, children's, and adolescents' health. I am Thies Boerma. I work for the Countdown, and I'm also at the University of Manitoba, and I'm going to moderate the first part, and then Sheikh Faye from APHRC and Countdown will take over in the second part. First, a couple of announcements. We have interpretation available, as it says here, yes, in French and Spanish. So just use those channels if you prefer those languages. We have a Q&A feature to put your questions. We will not use the chat box for this, so please put your questions in the question and answer box. And we will be recording this session. So just a few words to introduce it. I think it was about 2,000 years and a little bit more ago that the philosopher Plato said, you know, a good decision is based on knowledge and not on numbers. And that was certainly not the philosophy that the Countdown to 2015 had when they started producing evidence and make evidence-based noise about 20 years ago, and then started to produce countdown profiles on child survival. The coverage of interventions was the central theme with inequalities. And then came the child, the mother, to add to the child in the profile. Then came the neonate, then came the adolescent, then came the stillbirth, and survival data were added. Cause of death data were. Can everybody mute, please? Or can you mute everybody? Sorry. So we had survival data. Causes of death were added. Coverage data were expanded to include the continuum of care. Equity data, multiple dimensions of equity. Policies and systems, so it grew and grew. So what perhaps was just one page in the beginning as a profile is now several pages and multiple profiles. But for us all, I think the key thing is how can we select the best information that we need for advocacy and action from all those numbers that are flying around? How can we make sense of it? And that is what these profiles are about. It can be a very valuable instrument for advocacy. So we have 4 presentations related to the profiles, 3 from the Countdown, 1 on the overall profile, the continuum of care, 1 on the equity, and 1 on the early childhood development. And we have a commentary also from WHO to hear what kind of profiles are available there to synthesize the data. And then we'll have question and answer. But before that, I'd like to introduce Helga Fockstedt, who is the director of the Partnership for Maternal, Newborn, and Child Health, to say something about the countdown profiles as a tool to promote and advocacy. Over to Helga.
Thank you. I'm so excited to be here today. As we all know, only what gets counted in the end counts, just because it has been made visible. It is vital that we measure critical issues and make this visible so that policymakers and programmers can be guided by evidence and reliable data in making the best cost-effective and right decisions, which will then lead to meaningful and impactful results. It also is important to ensure that all key partners have access to and capacitated in using these resources. This is the main intent of this webinar. For us in PMNCH, as the largest alliance for women, children, and adolescents, it is key to focus on evidence, bringing together more than 1,350 organizations in 192 countries across 10 different constituencies, including governments, United Nations, academia, NGOs, healthcare professionals, associations, private sector, and youth-led organizations and others. It is vital that we are able to equip our partners with evidence-based advocacy, which is our core function. Our job is to build on and make available partner data and accountability resources and ensure that a larger base of partners are capacitated in their use, bringing these partners to act on these, which results that their collective advocacy becomes more powerful and effective than any one single partner can do alone. We will ensure that each partner will be equipped to influence change, better policies, increased and better allocated financing, improved service coverage, and better targeted interventions across other sectors as well than health. This is more urgent now than ever before. Unfortunately, due to COVID, increased conflict, climate disasters, the progress has slowed, stopped, or regressed for many key areas for women and children and adolescents. This is unacceptable. We all need to do better to reverse that trend and to get back to positive progress. This webinar is carefully designed with this in mind. We encourage colleagues to use this opportunity to learn about different profiles that the Countdown 2030 have put together. Note improvements done in addition to other analytical work and explore how Countdown profiles can be used also in combination with the global strategy profiles, important resources led by WHO. Please share these materials with your colleagues. These, together with additional accountability resources, will be included in our accountability portal on our website. These, we think, are vital in strengthening all accountability and advocacy efforts. There are several reasons why the profiles are key for strong advocacy and as an effective tool for mutual accountability. One, as you will see from the presentations, these profiles not only provide reliable and comparable data, but are organized in a way to make data much more readily accessible to decision makers, be it policymakers, program officers, or civil society activists. Second, the profiles play a dual role, being useful as a planning tool for governments and partners to get an understanding of how well or where existing efforts are in reaching women and children, which needed services, or where and for which areas funds and actions need to be further prioritized to reach outliers and those truly left behind. Three, these profiles serve as a tool for advocates to call out and hold governments and other partners to account for especially commitments made that are not being implemented or needed to make commitments where there exists commitment gaps. This year, we are at the midpoint of SDG 2030. A number of high-level meetings on UHC and the pandemic preparedness, as well as our own Global Forum for Advocacy, will take place. And there is an opportunity to show the lack of progress for the WCA. There is a serious level of need for accelerated priority and actions for women, children, and adolescents by global, country, and partners at national and leaders at national level. This triple C situation has led to women, children, and adolescents' health needs to be put on the center stage. We at PMNCH are working to mobilize partners to follow up on existing commitments, primarily as too often we see unkept promises, much which the vulnerable and those left behind end up paying with their lives. This is unacceptable. Where there is a gap and need to reprogram and or mobilize new commitments, this needs to be called out and addressed. I also want to bring to your attention the 1.8 campaign, or campaign 1.8 billion adolescents and youth, and the Global Forum for Adolescents. As again, we see from the data, adolescents are left truly behind in planning, programming, and delivery of services which would address adolescents' needs in an adequate and meaningful way. Countdown profiles are a critical tool to support all of this work. As you can see on this slide, country profiles is critical for contextual background when making the commitment so that it is response to existing realities, where and what needs to be done, how to prioritize scarce resources. This will help. It is essentially important as well as for an ongoing monitoring and review, and actions to be taken to achieve measurable improvements for every woman, child, and adolescent, and ensure remedies were applicable. Only by looking at data, analyzing and understanding what's happening and what are effective activities, we can make a difference. We, PMNCH, are here with you to support your efforts by coordinating global reporting, synthesizing knowledge, and bringing together resources and partners to advocate for change. Thank you, Countdown and partners. I look forward to this webinar and for all of us to use these excellent resources, complement these with data visualization tools, and incorporate it in advocacy and accountability efforts so that packaged rightly for the right audience at the right time and through appropriate mechanisms, our efforts bring a better future for every woman, child, and adolescent. I wish you the best in your important part in all of this and hope this webinar is useful and motivates you to do more and better. Thank you.
Great. Thanks very much, Helga. That was, I guess, a very, very powerful and forceful advocacy for the importance of data. And that's music to my Countdown ears. So the profiles are really trying to synthesize all the data for monitoring and targeting, for advocacy, and for accountability. So let's go immediately into the substance. So what's in these profiles? So the first profile that we're going to discuss and present is the national profile, and also the first set ever of regional profiles. And this will be presented by Jennifer Coelho, who is with the Countdown, focusing very much on our work with the Global Financing Facility and many other things, because Jennifer has really been at the foundation of the Countdown profiles for many years and has also continued to be very instrumental in the last few years when she was with UNICEF. So Jennifer, looking forward what you can tell us about this profile. Thank you.
Thank you so much, Thies, for all of the background and for introducing me. Next slide, please. So as Thies has already given you a bit of a glimpse of the history of Countdown and the fact that it's a partnership and a strong collaboration across individuals and institutions, the Countdown profiles really reflect this partnership type model. So on this slide, you can see that putting together these profiles has involved a team effort. UNICEF takes the lead on producing the profiles. So I've listed the team members there from UNICEF. And then we've also worked really closely with the University of North Carolina at Chapel Hill and North Carolina State University on the design and back end of the profiles. And of course, there's been a lot of engagement with the Countdown technical working group that includes members of academic and research institutions from around the world. Next slide, please. So basically just what I'm going to talk to you about today is a little bit more on what the Countdown to 2030 country profiles are, and then to describe a little bit on the process of their production, including the types of data sources that are used to populate them. Then I'll go into a little bit more detail on each of the contents of the pages of the profile, and then a little bit further on how the country profiles can be used. And of course, as Ties has noted, this year marks the first launch of a set of regional profiles, so I will describe those in brief. Next slide, please. So what are the Countdown profiles? You've already heard from Helga and Ties that the first Countdown country profiles were designed and launched in 2005, initially as a response to a call to action to improve child survival that came out in the Lancet in 2003. Every year we update these country profiles, or every other year they're launched on the UNICEF and Countdown websites. As Ties had already noted, the original profiles were focused on child survival, but as priorities have shifted and as evidence has become more available, the profiles have also shifted to accommodate these changes and went from just a focus on child survival to covering the full continuum of care of maternal, newborn, child, and adolescent health. The profiles have a logic framework in them. They're based on the Common Evaluation Framework, and they still have a strong emphasis on intervention coverage and equity. There's also just a range of data on these profiles so that all of this information can be in one tool, one place, to make it easier for advocates and for country planners to use the tool for action. Next slide, please. So this slide is about the kind of giving you a better sense of what the profiles contain. So currently the profiles have 4 pages, so 3 sort of substantive pages, and then there's an additional bonus page because there's a chart that covers the causes of death, and it really has so much information that it required its own page. The other important factor here is that you are able online to access the profiles online and engage with the interactive features, as well as download PDF versions of them, either the full profile or separate pages of them. As I've already noted, the profiles are comprehensive across the continuum of care, and they are organized by type of indicator, as well as giving a little bit of a deeper dive into specific components of the continuum. The profiles, as I mentioned, are updated annually, so that means that the back-end databases are updated to ensure that the latest evidence is available to those who are using the tool. And that process is done through a very rigorous country consultation exercise so that there is engagement with countries on the type of information that's presented. Also to note that when you go to the website, you also have access to the metadata, meaning that all of the information about the data sources for each of the indicators is available to you, and users are able to download the backend Excel file of the data for individual countries or the entire data set across all of the low and middle income countries for which profiles are produced. Next slide, please. So this is just to again explain that the backend database is compiled from using publicly available data sources, all of which have undergone some sort of country consultation exercise. So this is just a listing of some of these databases. You can see that a lot of the household survey platforms serve as data sources, as well as UN agency websites, and then some special data compilations that have been put together, for example, by the London School, who is responsible for the finance analyses for ODA that we have on the profiles. Next slide, please. So now I'm going to get into a little bit of detail on what you'll find on each one of these pages. So on the first page, you'll find the bottom line information on mortality. So you can see over towards the right-hand side in the bottom that there are charts available that show trends in maternal and child and neonatal mortality and adolescent mortality. And then there's also a graphic on causes of death for maternal as well as neonatal, child, and adolescent. There is also a map that shows how well subregions are doing on providing an essential package of maternal, newborn, child services to women and children. And there's also then a countdown signature continuum of care chart that shows salient indicators across the continuum from sort of the pre-pregnancy phase through childhood, and then also includes some environmental indicators. There's also a box that includes a lot of sort of critical demographic information to provide some context about the country. Next slide, please. So then when we move into the second slide, we get into a little bit more of details and into the continuum of care. There is at the top a lot of information on nutrition, covering nutritional status measures, as well as infant feeding type indicators. Then when you move into the center of that page, you get a little bit more detail on specific components of the continuum. So critical indicators for maternal and newborn health are there in the center together. And then there are individual slides or graphics for child and adolescent health. And then, as I noted before, we have included some of the key environmental interventions here. So things like drinking water, sanitation, and hygiene are presented given how critical they are for women, children, and adolescent health. And there's also a box on some additional equity-related indicators and other child health measures. Next slide, please. For the third page, this gets more into the drivers of coverage, sort of the essential factors that provide an enabling environment for improvements in intervention coverage. So we have a set of legislative policies, including policies around family planning, maternity protection, breastfeeding, and legal status of abortion. There's also some measures around governance, including if the country has a costed plan or maternal death reviews. Then there is a section recognizing the importance of the health system. So there are some indicators that are included around the health workforce and health facilities. As I had noted before, we do have a section on financing, which includes both national indicators as well as the ODA measures, the official development assistant measures, to give a full picture of what the country is allocating towards women, children, and adolescent health. And then there is a little sort of extra bonus on this page to help people navigate the profile. So it includes information on all the acronyms that are in the profile, as well as the SDG targets, so that as you're looking at the profile, you can see how well the country is doing in progressing towards those targets. Next slide, please. So as I had mentioned previously, we have this bonus page, which sort of expands the cause of death chart, because it is so rich and full of information and hard to really see as it's embedded inside one of the other pages. So that is the purpose of this slide, is to just give you a little bit more detail around the leading causes of maternal, newborn, child, and adolescent deaths. Next slide, please. So there's also, when you go and work with the profiles online, we do have some additional online interactive features. If you could click again, Brittany, and just click one more time. So basically what I'm showing you here is that although we do have a whole set of annexes that are at your access when you go online to look at the profiles, we also have a hover function, so that if you scroll your mouse or your cursor over an indicator, the metadata will pop up so that you can see, right as you're looking at it, information about the data source and other important details on that particular indicator. Next slide, please. So I think Thies and Helge have already really emphasized the use of the country profiles, but I will just again iterate here that we see three main target audiences for using these country profiles. First, and to emphasize Helge's point, these profiles can be put into the hands of civil society organizations and advocates to highlight where progress has been achieved and to really call out where there are continued gaps and concerning issues that governments and partners need to be held to account for improving. Also, really importantly, we envision these profiles as planning tools that country governments and partners can use during annual review cycles to sort of identify where they might need to prioritize more resources and where they could learn from examples of success. And then not lastly, but thirdly, also these profiles can spark really important research. So they lay out a lot of important information about progress, but then there can be further building off of the information that's in the profile, research to explore more on why progress has been achieved, and also more comparative analyses across countries. Next slide, please. And I'm very pleased to be able to announce that we have our first set of RMNCAH regional profiles. The whole purpose of these profiles is to provide a regional lens on the data. The profiles include regional aggregates for all indicators for which we have data available. It provides a possibility to compare progress across countries in the region, as well as sort of a scorecard on how the region itself is doing. And again, this is useful because it can help at the regional level for identification of which countries are succeeding, which others might need a little bit more focused attention. And it enables countries themselves to have a means of comparing how well they're doing to other countries in their region. Next slide, please. So what does it look like? Here it is. This is the 3 pages that we currently have for what we're calling the standard regional profile template. This profile template has been used for all of the UNICEF regions. And then I just want to flag that the UNICEF team is leading a consultative process with each of the regions to also generate some customized pages based on their particular priorities and epidemiological profiles. So the standard pages are useful for enabling comparisons across regions, but then there is this interactive process with the regional partners to identify some additional indicators that they want to be able to monitor. Next slide, please. So just a little bit more information. The regional profiles enable you to toggle and select if you want to have the regional view. So here we're showing an example of a particular indicator where you can just look at the regional trend, or you can select the country view, and then you will see the trends for each of the countries in the region. Next slide, please. And then the other issue here is that it enables a viewer to take a look and see what's the regional average, and then how is each country performing on a particular indicator. So here we have on the left-hand side, again, the Countdown's signature continuum of care chart that includes key interventions across the RMNCH continuum. And then within there, what you're meant to see is the gray bar shows you the regional average for that particular indicator, and each one of the dots shows a country specific value. And then in terms of equity, we're basically showing here the difference in coverage levels for interventions by wealth quintile. Next slide, please. There's also another feature where you're able to select the amount of information that you'd like to show. So similarly to the national profiles, the cause of death data is quite robust. So here you're able to select if you just want to see the top 5 causes, top 10 causes. So it gives you a means of controlling the type of information you'd like to see. Next slide, please. And then just to note that we recognize that there are a wealth of profiles and tools that cover the continuum of care for women, children, adolescent health. So UNICEF has put together a one-stop shop where a lot of these tools are put together, including the Countdown tools and the global strategy tool that you will hear about later. And then it has some other resources that are useful that complement these profiles that may be thematic specific profiles and others. Next slide, please. And that is all for me. Thank you so much. And I'm going to hand it back to you, Thies, now for the next presentation. Thank you so much.
Thank you very much, Jennifer. That was a great overview. And just like to stress, the regional tool is really a good step forward, because in accountability and advocacy, using comparative analysis, looking at how well country X is doing versus Y, is really impactful. So I think that's a welcome addition. I also love the bonus page. That is really nice, and you don't even need a coupon for it. You can just get into the bonus page with anything else. So the next one is on equity, and equity, of course, is very central to all our efforts in women, children, adolescent health and nutrition. And in fact, it should be in our DNA as public health people. And in the field of equity data, the International Center for Equity and Health in Pelotas in Brazil, led by Cesar Vectora and Aloisio Barros, has played such a fantastic role in promoting and further developing this field over the past 2 decades. That is amazing. In fact, these guys, I think, they have equity data for breakfast, they have equity data for lunch, and they have equity data for dinner. And Aloisio Barros is one of those people who lives on those. So we're very keen on hearing from you, Aloisio, to what is in the equity profile. Over to you.
Well, okay. Thank you, Thies, very much for your kind words. Well, I am Aloisio Barros, as Thies said. I am with the University of Pelotas in South Brazil and with the International Center for Equity in Health. Next slide, please. And this is the team of the center and the group that actually produces these profiles. It's a very dynamic, young, diverse group, and it's a great pleasure to work with them. Next. Our group works in sort of 3 main areas. So one is keeping this mega database of health indicators that uses national health surveys. We now have data on 122 countries and more than 400 surveys. We do a lot of dissemination work, focusing on monitoring and accountability, and science work as well, sort of training postgraduate people and doing work on the patterns, trends, and determinants of health inequalities. Next. This mega database covers, as I said, a large number of countries, 122 scattered all over the world, focusing on low and middle income countries. And the outcomes we work with are mostly intervention coverage indicators, combined indicators like the CCI, co-coverage. I'll talk a bit about them very soon. And we also have indicators on child mortality, nutrition, and fertility. To do the equity analysis, we need equity dimensions. So we stratify these indicators by subgroups. And these subgroups are based on wealth, on women's education and age, on urban and rural residence, country, region, child sex, ethnicity, and women's empowerment. Next. So this data needs to be presented in an easy to sort of understand way. And we have been using a lot this type of visualization that we call the equiplot. And this type of graph shows coverage with the selected indicator by subgroups. And in this case, we have modern contraceptive use for Brazil in 4 different time points. So we start, you can see, in 1986 with wide gaps between groups. And these groups are the sort of to the left, the darkest blue, the 20% poorest women in the country. And sort of then we go up point by point. Each group is sort of the next 20% up to the 20% richest in the country. So you can see clearly that in 1986, there was a very wide gap between the poorest women and the richest ones. So it's from about 25% use of contraceptive among the poorest to around 80%. As time goes by, we see a huge reduction in inequalities, and the poorest women sort of get closer and closer to the richest ones, so that in 2013, we basically don't have any gap anymore. So easy to see, easy to interpret. So it's why we like this type of graph very much. It can be used to present different time points here. It can be used to present different indicators, as you'll see very soon. And the stratification, well, can be wealth, can be rural and urban residence, can be levels of education, whatever you want to present. Next. So now we get to the profile itself. And our profile has 4 pages. And so 3 pages with information and data, and the last page basically with a key to interpretation and definitions of the indicators used. So the first page is sort of the more colorful and dynamic. We have a map, equiplots, an infographic. The second page, we have a table with our key indicators, with estimates at a national level and is stratified by selected equity dimensions. Page 3, again, our key indicators by subnational region. Next. So which are the indicators presented? We have 12 individual indicators, sort of coverage, so from the sort of reproductive health, like demand for family planning satisfied with modern contraceptive methods, through maternal and neonatal health, antenatal care, a skilled attendant at birth, and so on, child health, vaccines, care seeking for pneumonia, and then nutrition, early initiation of breastfeeding, exclusive breastfeeding, blah, blah. Next. We also have this composite coverage index that Jennifer mentioned quickly before. It's a composite index that is a weighted average of 8 interventions that cover 4 stages of the continuum of care. And what's the idea here? This indicator can be interpreted as an overall indicator of RMNCH intervention coverage. So it sort of summarizes the whole thing. And it can also be seen as a proxy for universal healthcare in the context of RMNCH. Next. So let's zoom in page 1. Next. So we have a map, and here we show the CCI, the Composite Coverage Index, by subnational region. We use the administrative 1 level for that. And here in this example of Nigeria, for instance, we have large variations across regions, going from 64.7% of the CCI to 37.8%. We also have on the bottom right part of the map a simple equiplot showing CCI for the 5 wealth quintiles at national level. So you can see here that we have CCI varying from around 30% to a bit over 70%. Next. Then we have this equiplot where we show our 13 indicators by wealth quintiles. And so you can see that for all except 1 indicator, the richest are better off than the rest. Some of them present wide gaps, like skilled attendant at delivery. Some of them are sort of narrower, not as large gaps. And notably, we have continued breastfeeding at 1 year when we have a completely reversed order of the quintiles, with the wealthiest babies being the least breastfed at 1 year and the poorest being the most breastfed. So, complete picture of coverage with these indicators stratified by wealth quintiles, comparing from the poorest to the richest, and you can have this broad picture of what's going on. Next, please. Then we have another equiplot that presents an intersection between wealth and urban and rural residents. So here you can see coverage across the wealth quintiles, but separately for rural and urban areas. And generally, very typically, what we see is that the poorest in the rural area are worse off than the poorest in the urban areas, while the richest, they can protect themselves and receive sort of relatively similar levels of coverage in either urban and rural areas. Next. Then we have another equiplot with our 13 indicators, now by urban and rural. And what we see is a systematic advantage of people living in urban areas compared to the rural populations. Again, you see that the widest gap is for skilled attendant at delivery. And again, we see a reversed pattern for continued breastfeeding at 1 year, with rural babies being more breastfed than urban babies. And next. Then we go to one of our composite indicators. This is the coverage of essential interventions. So we selected 8 interventions, and we count how many of these 8 interventions every pair of mother and child received. And then we present these counts by wealth quintiles. What you see here on the left bar, and we often call this a pie graph. What you see on the left bar that represents the poorest, that about 60% of the poorest population has 0 to 2 interventions, received 0 to 2 interventions, while when you look at the wealthiest, no one received only 0, 1, or 2 interventions, but more than half of them, or more than half of them received 6 or more interventions. So huge differences in terms of coverage between the poorest and the wealthiest. Next. Finally, we have this infographic where we try to show how some of these pairs of mothers and children who received less than 3 interventions are concentrated in some groups. So on the right, you see, for instance, that for all mothers and children, 22% of them belong to the poorest quintile. While when I look only at the mothers and children with less than 3 interventions, they are concentrated, 42% of them in the poorest quintile. And that is repeated across rural areas, the northwest region in Nigeria, and mothers with no education at all. Next. Well, then we're done with page 1. That is the sort of more informative and more complex. But if you want to go into the numbers themselves, you have them, all of them, in page 1. So you have the estimates at national level, you have the estimates stratified by wealth quintiles, you have some equity indicators like the ratio between the richest and poorest, difference, the concentration index, and the slope index of inequalities. We also have stratification by women's education, child sex, and area of residence. Next. Page 3, again, estimates by regions of the country. Of course, this will vary a lot, from one country to another. So some countries have a smaller number of regions, other countries have a very large number of regions. So you see a very number of columns as you go through different countries. Next. And finally, page 4, explanations. So a general explanation of what this profile is, detailed definitions of each of the indicators used, explanations of the composite indicators, the CCI co-coverage, and some help interpreting these graphs. Next. So all of these profiles can be found at the Countdown website. And you have the link here. You can scan the QR code and go directly to them. And there you will find 118 countries with profiles. We use the latest survey available for each of these countries, mostly using Mix and DHS surveys. And the range of dates is from 95 to countries that don't have a newer survey, a more recent survey, to 2020. Next. And that's it. Thank you very much. And you are welcome to visit our website that is indicated here. Over to you, please.
Thanks very much, Aloisio. Equiplots, tie graphs, and pie charts. It's a great synthesis, this equity profile. So let's move right on to the last countdown profile of 3. And of course, we try to integrate all the different components of RMN, CAH, and nutrition as much as possible. But early childhood and development has been, of course, an area that has had special attention, particularly through the work of UNICEF and through the work of a group led by Linda Richter, who have been sort of developing and driving this agenda for the past few years. So looking forward to hear from you, Claudia Kappa from UNICEF, on what is in the new ECD profiles.
Thank you so much, Thies, and good morning, good afternoon, good evening, everyone. And I'm really pleased to present the ECD Countdown profile on behalf of the ECD Countdown Working Group led by Linda Richter. The ECD country profiles present in one place the latest, most comprehensive information that will allow us to assess country progress in improving the health, development, and future prospect of young children all over the world. So if we go to the next slide, I want to give you a little bit of an historical snapshot of how these profiles were developed. So we obviously started the work within the context of the larger Countdown partnership. But as Thies mentioned, it was immediately evident that there was need to specifically have a focus on the health and development of young children. A critical moment in this process was the launch of the Nurturing Care Framework in 2018, which represents a comprehensive set of indicators that countries can use to track progress toward improving the well-being and development of young children. The Nurturing Care Framework, as I will mention later on, is the underlying framework that is used to collect the data that are presented in the country profiles. And to reflect those indicators, the first set of country profiles were released in 2018, covering 91 low and middle income countries. The next year, in 2019, we updated and expanded the ECD country profiles to cover 138 low and middle income countries. In 2020, we updated further these profiles and expanded the country coverage by including data for 197 countries. And we will continue to do so by releasing the country profiles every 2 years, all the way until 2030. Let's go to the next slide, please. As I mentioned earlier, the nurturing care framework is the framework that we use for the country profiles. So the country profiles are structured and present data around the 5 components of the nurturing care framework: good health, adequate nutrition, security and safety, early learning, and responsive caregiving. Of course, we also include information about the facilitating environments that are critical for the components of the nurturing care framework, including information on caregivers, communities, services, and policies. And of course, the nurturing care framework is the ideal framework because it's fully aligned with the SDG. It's at the heart of the global goals. So there is a clear connection between the elements in the nurturing care framework and the country profiles and the broader SDG framework. Now, going to the next slide, I wanted to give you a quick overview of the main indicators that are presented in these profiles. First of all, we have 4 demographic indicators that give you the sense of the population in a country, the actual and annual number of births, the population of children under 5, and the under 5 mortality. Then we have 8 indicators related to what we call threat to early childhood development. And these include a range of indicators going, for instance, from maternal mortality to stunting for the population of children under the age of 5. Then we present 6 indicators on what we call outcome measure related to early childhood development. And in this case, we present, for instance, information on the percentage of children who are developmentally on track, the percentage of children with functional difficulties, for instance, but we also include some differences on key indicators by gender and residence. Then the profile presents data for the 5 components of the nurturing care by illustrating the available evidence and statistics related to health, for which we have 4 indicators, nutrition, for which we have 3 indicators, security and safety with 4 indicators, early learning, 4 indicators, and responsive caregiving. And in the case of responsive caregiving, unfortunately, we are not yet able to report due to the lack of internationally established and validated indicators. And at the bottom of the profiles, we have 9 different measures, 5 related to policies, including, for instance, policies related to, for instance, leaves, maternal and paternal leaves, and then information about international conventions that are relevant for the development and well-being of young children, including, for instance, the Convention on the Rights of the Child and the Convention on the Rights of Persons with Disabilities. Now, going to the next slide, I would like to give you information about the data sources that are used to populate these country profiles. Now, these country profiles are meant to be used in the context of global monitoring. So one of the elements that is critical for monitoring is the fact that we need to be able to use measures and data sources that are internationally comparable. So the data that are presented in the profiles are compiled from publicly available global indicator databases that are used for a number of purposes, including for officially reporting on the Sustainable Development Goals. These databases include primary data sources, such as UNICEF-supported multiple indicator cluster surveys that have been mentioned earlier, also as an important source of data for the other profiles that are part of the Countdown family. But we also include data coming from demographic and health surveys that are being supported by USAID. We also have, of course, national level representative household survey and censuses that are specific to certain countries, but use methodology in tools that allow these surveys to produce data that are comparable at the international level with, for instance, mixed and DHS surveys. And in some cases, we use modeled estimates. Of course, we also have, for an indicator, country level data published in high impact journals. And for all these data sources and indicators, we have detailed information and metadata information at the that accompany the country profiles. There is a technical appendix which include indicators definition, and of course we have Excel databases where this information can also be found. Going to the next slide. So I just wanted to give a very quick snapshot of the evolution in terms of coverage of this country, geographical coverage of this country profiles from 2018 to 2020, where we increased the number of country profiles from the initial 91 that were low and middle income to practically 197 countries, including 63 high income countries. And what was particularly really revealing as we expanded the geographical coverage of this profile, it became very clear where the gaps in terms of data availability still persist. And maybe surprisingly, we realized that many data gaps exist in high income countries because these countries do not necessarily become part of international survey programs. They have other data sources, but they also lack significant data when it comes to certain indicators of well-being for young children, including, for instance, data related to parental stimulation and care, as well as parental discipline. Going to the next slide. These are just the snapshot of this profile. This is how the profile look like, and the profiles are now available in 5 languages. And we hope that this can be, in a way, another way to foster the use of these profiles. Going to the next slide, please. What do we learn from these profiles? Of course, the profiles contain country-level information, but then we also prepare summaries to illustrate the main findings across these 197 countries. And what do we learn? Well, globally, around 2 in 3 children under 5 with symptom of acute respiratory infection receive advice or treatment. So only 2 in 3. So there's still a lot that can be done with respect to providing this type of advice and treatment. Fewer than 1/3 of children are attending early childhood programs. So participation in ECE remains low, of course, with great variation across countries, but overall, less than 1/3 of children worldwide are attending early childhood programs. Only 2 in 3 young children in countries with data benefit from regular early stimulation by caregivers at home. And we know how important early stimulation is for child development, yet only 2 in 3 young children in the countries for which we have available data receive early stimulation and caregiving from from parents and other caregivers in the home. And nearly half of countries do not have any form of paid parental leave. So this is another important findings that we derive from the summary of this ECD country profile. Now going to the next slide. I think the profiles are also useful not only to illustrate how children are faring in these different countries, but they're also useful to illustrate, as I mentioned earlier, data gaps. And significant gaps persist in the area of responsive caregiving. Also, in the case of ECD indicators, many countries lack historical data that prevents us from being able to look at trends over time and see whether countries have made progress, for instance, with respect to certain specific aspects of children's development. And then, of course, we also have to recognize that even with the available indicators and data, there are still gaps when it comes to, for instance, quality of the care that is provided for children, and also indicators related to indoor and outdoor air pollution, which we know has significant impact on children's development. So we are nearing the end of the presentation. I just want to very quickly go to the next slide to really push for use of these profiles. I've seen there is a often reference to resources not being available in terms of evidence and data on a number of indicators. Well, regardless of the persisting gaps, these profiles really represent a great resource. And what we want to do is to foster the use of these profiles that was mentioned earlier for advocacy, for insight, for discussing with policymakers how the countries are doing with respect to early childhood development. And of course, again, we can also use the profiles to demand more and better data. So that's where the focus of our action will be going forward, on really accelerating efforts to use and disseminate the data to improve early childhood well-being and development. So thank you so much. And back to Thies for the continuation of the webinar. Thank you.
Great, thank you, Claudia. That's a wonderful tool, and yeah, really an area where we need to do so much more. So thank you for that. So let me move right on, because obviously countdown profiles are not the only kid in town. And Teresa Diaz from WHO is gonna position them a bit better and also talk about global strategy profiles. Teresa.
Thank you very much, Thies. I'm going to talk about the Global Strategy for Women, Children, and Adolescent Health 2016 to 2030, and I'm going to talk both about data visualizations and specific country profiles that we have. Next slide. So first, let's explain what the global strategy is. The global strategy has 3 objectives: to survive, thrive, and transform. Survive means to end preventable deaths. Thrive is to ensure health and well-being. And transform is to expand enabling environments. So, you know, in 2016, there was the launch of the 2030 Agenda for Sustainable Development. And around that same time, there was a World Health Assembly resolution, 69.2, which was the 2016 to 2030 Global Strategy for Women, Children, and Adolescent Health, which I'll refer to as a global strategy. And it was developed to translate the agenda into concrete guidance on how to accelerate progress through a multi-sectoral approach. Next. So an indicator and monitoring framework was developed at the time. It was based on technical reviews and an open consultative process, and the 60 indicators were selected. They referred to the priority areas of the global strategy and have proven measurement track record. The framework was aimed to minimize the burden of country to global reporting. So it's aligned very well with 34 indicators from the SDGs. And there's an additional 26 indicators that was drawn from established global initiatives at the time in reproductive, maternal, newborn, and child and adolescent health. And from the 60, 16 key indicators were selected as the minimal subset to provide a snapshot of progress on the global strategy. Next slide. I'm not going to go into detail on these, just to show you what the 16 are and how they fall into the survive, thrive, or transform category, but I'm not going to go into detail through these indicators. Next. So we have in the World Health Organization a data portal for women, maternal, newborn, child, adolescent health, and aging. And in there, we have a component that is a data portal for the Global Strategy for Women, Children, and Adolescents, and includes data from 194 member states. And it has the most recently available data for all those indicators and it's been compiled in one place. Here's the link. And it brings data together from various sources and also highlights gaps in data availability. Next. So with this, you have interactive visualizations. You can go onto the map. You can choose one country. You can choose two. You can choose 3 countries. And then you can have a visualization, a trend line or a bar graph, for example, shown here. And it's based on what the indicator is. So whether it should be shown as a bar graph or if it does have trends. But this just gives you some examples of the interactivity that does exist. Next. So we too have country profiles. We too have profiles in which you can take all the different parts of the profiles, or you can just choose different sections of profiles. And here I'm just giving you an example of Afghanistan showing the full set of what's available. And it shows the key indicators, and then it shows the survive indicators in addition to the key indicators. Next slide. And additional survive, and then it goes to the additional thrive, and then the additional transform indicators. Next slide. And I just wanted to say before I go through this slide, you can go choose what part of the country profile you want, and you can have it pulled down by a PDF file if you want to download the country profile. I also wanted to explain that whenever we update any of the data in our regular data visualization, it also updates the profile. So you may be wondering, well, what's the difference between this profile and the countdown profiles? Now, I'm going to be referring to the main countdown profiles here, not really the early child development or the equity ones, to explain what the difference is. So mainly it's the way in which visualizations are displayed. But also the global strategy is 194 member state countries with 60 indicators. And the main countdown profiles are low and middle income countries and not necessarily all 194 member states. Now, most indicators overlap between the countdown and the global strategy, but some visualizations within the countdown profile have some increased disaggregation. I just want to make a very important point is that if the same indicator is presented in the countdown profiles or in the global strategy, it's the same data source. People have always said, oh no, I'm seeing different data sources. No, it's the same data source. If there's ever a discrepancy in the number, it just has to do with whether one was updated earlier than the other. Next. So I wanted to go through future plans. Next. So we are trying to improve the visualizations. We're working on improving the exportability of the visualizations, and we want to work on the speed and reliability of the site. So we are in the process of trying to do all of that, and hopefully we'll have even a more dynamic and faster visualizations and country profiles in the future. Thank you.
Thank you very much, Teresa, for making that link to the global strategy and also sort of clarifying why there are multiple profiles. And I think you gave a great explanation. We all have a common goal. Use the data. We make it easy for you. We try to stay updated with everything. Use the data for advocacy, accountability, monitoring, and targeting. So that was a great overview. So let me now hand over to Sheikh Fai. Sheikh is the head of the West Africa office of the African Population and Health Research Center, which I think is the leading institution in data and analysis in Sub-Saharan Africa. And he is also, since January, the director of the Countdown to 2030. So Sheikh, over to you.
Thank you so much, Tis Burma, and thank you for the nice moderation. And we are quite excited to have heard such great presentation from our distinguished speakers, Alicio, Jennifer, Claudia, and Teresa. I think we've heard great things and great data that actually will be very useful to the countries going forward. So now that we have this chance of really having this great presentation and these panelists also here, we would like to engage into some discussion just to learn more about this profile and also engage into how to use it, how to make sure that it's beneficial to the countries. And by doing that, I would like to have our panelists maybe activating the video to get ready for some of the questions I would want to ask, maybe starting with the profile on equity, which actually was really, interesting. A lot of discussion on the channel about breastfeeding and things like that. Just to say, Lucio, when you look at this profile, I know people, some are not used to this equiplot and all that, but probably you may have another easy way presenting those data. If that's the case, please tell us a bit more about that. And then also, what are, the inequalities, the inequality dimension that we use are all focusing on wealth, urban, rural, and so on and so on. Haven't you thought about adding some other dimension, something like gender in those equity analysis? Just to start with you, Lucio.
Right. Thank you, Chef, for your question. Well, I think one of our main goals with this center is to present inequalities and give people a sense of health equity in a clear and intuitive way. So I think the Equiplot was one of our strategies. We started sort of playing with this type of graph more than 10 years ago, and we would sort of show different types of graphs to people and see what they would find easier to interpret and so on. And we ended up with the Equiplot. So I think that this one I really like, and I think it's really easy. Some of other presentations, I particularly have a bit of a problem with the infographic we show in our profile. I think after you understand what it's showing, I think it's really interesting. But I think it's not very easy to grasp what it is that is behind it. So I am still looking for some way of presenting that in a sort of more intuitive, simpler way. The tie graph, I think, is easier to interpret than that. But that infographic, I like the information, but I don't like very much how hard it is to sort of, you need to stop and think until you understand. When you have this reaction, say, okay, you're fine, you go ahead, and it's really, really interesting. Regarding the dimensions of equity, this is one thing that we have tried to push forward in the past few years. So we started with these very traditional dimensions like wealth, so looking at the range of wealth levels from sort of the poorest to the richest, urban, rural residents, education, sex, especially sex of the child in the indicators we work with. But we have been trying to push forward with that. And I think recently we have made very good progress. We have been doing a lot of work on ethnicity and sort of exposing the huge inequalities that exist across ethnic groups. It's not very easy. In some countries you have dozens or sometimes hundreds of different ethnic groups, so it's not easy to present those. But it's something that we have been working with, and we want to go forward because I think it's really important. The other aspect is religion. Sometimes it's seen as sort of a sensitive area to work with, but I think it's important. And we have been doing some work showing important differences and things that sometimes I think in terms of action. It's relatively easy to identify these groups and work with religious leaders and so on with a specific aim. And finally, gender. We have been doing a lot of work with a sort of a gender lens as well. And especially we developed this indicator of women's empowerment that we have been using more and more. So that we have these 3 dimensions of women's empowerment in this indicator we proposed. And that's something I would like in a future revision of this profile to include something related to women's empowerment and show how several of these health indicators we work with are related to empowerment and how important it is to invest in women, invest in empowering women and girls to sort of make even more progress. Thank you.
Thank you so much for such detailed response, and I'm sure we are going to take time to digest this equity profile. They are really useful and will provide a lot of information for the country. So heading to Jennifer, just with 1 or 2 questions. We've been really impressed, Jennifer, by the effort that has gone beyond background and what we know and in the background, actually, for you to come up with these bonus pages. I like those. You know, you summarize this course of basis. That's very important. And then also the innovation of bringing out also regional profile. I think this has been a high-level demand, and we really commend you for this such a great achievement. So now, what steps would you kind of recommend for policymaker or let's say civil society member to take use the country profile for their needs? And also another thing, the added value of the regional profile, because we when you have the national profile, you also have the equity profile and all that, but all of this is to help drive action for women and children. But how do you connect all that, make sure that, you know, we are saying the same thing without confusing people? Over to you, Jennifer.
Thank you, Sheikh. Those are great questions. So as you know, with all of these tools, the national equity ECD profiles and the regional profiles, they're really meant to be a starting point for discussion. So to drive action. So just to answer kind of briefly, I would suggest that if someone wanted to start using the national profile, that they might just start with a review of the data that's presented on it. For example, taking a look at the mortality and nutritional status trends. Are they headed in the right direction? How well is the country progressing towards global goals? How then can you take a look at that continuum of care chart and assess whether the country is progressing towards universal coverage, or are there key gaps along that continuum that should flag, you know, interest in addressing those gaps? Similarly, there's the sort of some equity information on that national profile. How well is the country doing in reducing inequities for the richest and the poorest in the country? And then similarly, taking a look at the drivers, what kinds of policies are in place to support the scale up of intervention coverage? And again, looking really closely at the financial piece, how well is the country prioritizing MNCAH for allocation of resources, and what support are they getting from development partners? So that would be sort of like a first step for whether it's civil society members or policymakers that want to use the tool. The next would be sort of related, would be kind of what are the opportunities now that you can see by looking at the combination of the data that's available in the profile. So for example, how well do those intervention coverage levels match with the mortality trends that you're seeing? Is there some consistency between the burden issue and how well the country is doing in reaching universal health coverage for women, children, and adolescents? And then the similar kind of thing, do we have the policies in place that allow women to stay home after birth, to establish breastfeeding, and other kinds of supportive measures that enable women to provide diverse diets to their children, things like this. So those would be sort of the two steps that I might suggest people use. Another factor that I think was really importantly raised by Claudia is that there is also another important element to these profiles of making evident data gaps. So that's another sort of point of action of are we missing information for key indicators, and what does that mean in terms of investments in strengthening health information systems in countries? So I think those are some of the main ways. I did want to note that there's a question in the chat about how can people sort of take some of this information and the analyses that Countdown does, and if they're flagging that there are huge inequities or noting that the profiles are showing inequities, can that information then be tailored for a proposal for funding to address those inequities? And I think that's a great idea. So certainly these databases and all of this rich information in the profile should be used in that sense as well, of having it be justification, like the evidence is showing there's an enormous gap between the poorest and the richest, and something needs to be done to have more targeted policies and interventions for the poorest quintile. So certainly that would be another way of taking this information and driving some action. Then Sheikh, just quickly, your question around the added value of the regional profiles. I really liked Thies's reflections on this, and I completely agree with him that those regional profiles are really useful for, again, giving a sense of how the region is performing, but as well, then it enables countries to see how well they're comparing to other countries in their same region, which is a very important point of comparison that countries often make. And it allows people that might be operating at a regional level to make some decisions about where more focused attention might be needed if a country is performing much lower than other countries in the region. It just is a really good way of identifying where action is warranted. So the other part of that question that you asked is, I really liked also Teresa's framing of kind of seeing these profiles together, that they're also sort of harmonized in certain ways, so that we're sharing not contradictory information, but clearly driving home messages. So I think, again, the regional profiles provide those additional features where you can do comparisons across countries as well as get a sense of how the region is performing. But then those national profiles, ECD profiles and equity profiles provide even more information. So for example, if you're looking at the regional profiles and are really interested in how one particular country is doing, you can then turn to the national profile itself and get more information. And then if you really, really want to know more about the equity patterns, you can complement that with a deep dive into the equity profile. And then if you're interested in the child thriving agenda and early childhood development, then that other profile can be used. And so there's sort of a suite of tools that really give a good sense of how countries are doing in delivering for women, children, and adolescents. So thank you. Back to you.
Thank you so much, Jennifer, for this really elaborated response. And I like what you said about these complementary around this profile, because they are mainly using the same data sources. But when you read one and another, you see how they're connected and really what added value you get from each of them. So thank you so much for that. And heading to Claudia. Claudia, you really presented and emphasize your the ECD profile. And you explained very well the nurturing care framework, which is quite exciting. But then if you look at what you've presented, and I like, by the way, the fact that those profiles are available in many languages. You say they are available in 5 languages. Congratulations for that. That has been a demand. When you think about updating some of those data, because when you start engaging countries with those, there may be some update here and there and trying to maybe improve or put some other new data. What will be the process of how can a country really submit update to the data that are included in the ECD profile so that it really reflects what they are thinking? What's the way?
Thanks for this question, Sheikh. I'm actually going to respond on behalf of Claudia. She unfortunately had to step away, but my name is Nicole Petrowski, and I work in Claudia's team in the data and analytics section of UNICEF, supporting the work around the ECD countdown country profiles. So that's a great question, and something that we actually get asked quite often by countries. So as Claudia mentioned during the presentation, the data that we compile to feature in the ECD countdown country profiles are coming from global publicly available databases. And these are databases that are updated, maintained by UNICEF in some cases, by other UN agencies and other organizations and institutions. So for the updating of the countdown, the ECD country profiles, it is simply an exercise of compiling data from these existing global databases. And most of those global databases, the data that is featured and that goes into those databases have gone through a separate dedicated country consultation process. So there's been a process by which those agencies, those institutions have consulted with countries to validate and verify the data points that are going into these global databases. And then we simply, provide a service by compiling all of that information into a master database that brings together the data from these different indicators in these existing global databases. So we don't, from the ECD country profile side, we don't undertake a dedicated country consultation process, because all of the data that are featured in the profiles have already undergone these separate dedicated consultation processes with countries to validate and vet and verify the data. So we ensure that the data that are featured should be those that are, have undergone this type of dedicated country consultation, and are the most, updated, most reliable data source for each of the indicators for each of the countries. Thanks very much.
Thank you so much, Nicole. Yeah, this is also a great point, because I know anytime we try to engage countries into presenting those profile or expanding, there may be several discussions here and there. It's good to point out the process and how we come up with those profile, and how that could be improved in future. But heading to Teresa, who have also presented the global strategy profile, quite exciting. And I think we are learning a lot out of this profile. But then the same question also around suggestion on how to improve those profiles if it comes from countries. What is the process really to make sure that those suggestions, those input could be addressed in the profile? And then in terms of the use of those profiles, because where you have a lot of data, graphic, and all that, here is also very interesting to see this infographic and all that. If you were to advise them how to best use those profiles at the country level, what would be that advice? What would be the advice? Over to you, Teresa.
Thank you very much. I'm going to start with the use first. And you've already heard Helga and Tees and Jennifer and Nicole and Lucio talk about how you can use the different profiles. I'm just going to explain the difference between having a country-specific profile and then the ability to do comparisons. So in our visualization portal, you can, and this is not the country global strategy country profile per se, but the other part of the global strategy data portal, you can choose like 2 countries, you can choose your neighboring country, and you can look at both of them for the same indicator and do a comparison. And those are kinds of things where you can bring back to your country and say, look, the country next to me is doing much better than we are. Why is that the case? When you're looking at the country profile itself, it's worth for you to go through all the entire different parts of it to say where is your country doing well and where is your country not doing as well. What different components, maybe they're doing very well with child health, but very poorly with maternal health, for example. So that's what I would suggest for the profiles. But with the global strategy, the key thing is these countries made a commitment. They said they were going to improve women and children's health. And so did that happen? Many countries made that commitment. If you go to what Helga described as the PMNCH webpage accountability page, you can see what your country had promised. And then you could see the outcomes looking at these data and profiles and say, hey, did you actually make improvements, or there was no improvements? What is going on? And you can use that to push further to make sure that your country is making these different improvements. I wanted to point out one thing before I tell you how you can give input. And I know that somebody asked about being able to use these data for grants and so forth. I wanted to make a point, both UNICEF and WHO, you can actually download the actual data itself. And you can, if you have the capability to do analyses, you can download the data and do those analyses yourself. So that should help with any kind of proposal that anyone might want to put forth. So for us, we're in the process, as you saw at the last slide, of trying to make improvements to the visualizations and interactivity. And so there is a email as mncah@who.int. And if Gerard is still there, he can put it into the chat, where you can make suggestions. Our only limitations really are our IT systems. So if it's not something that's possible within our IT system, we can't bring those forward. And any suggestions, try to be as specific as possible, because that helps us with trying to make the modifications. Thank you.
Thank you so much, Teresa, for the great responses. I think this is great. I know we've just come to the end of this webinar, but I know there are sort of questions that I'm seeing in the chat and also some great answers. But just to mention a few things to wrap up, these profiles are really useful and are really kind of demand for the countries. I remember anytime we have this profile lunch, you try to pick some of them and try to present to help government and stakeholders to understand better and maybe even take action, because I've seen some countries have taken action in the past based on some finding on this profile. So that's very important. And one important move also I've seen is actually this regional level profile, because that has been also a great demand. And I really want to commend all the team who have been working hardly to have this profile, this regional level profile, because they help a lot. Sometimes we talk about, let's say, this country, but then when you look at the global, the regional trend and the regional averages, you see where you are, and the country is more encouraged to be doing effort and try to achieve the goals or the SDG goals. So this is also important. And then the fact that also now we have the profile in several languages. Thank you so much for this. That's very good, because we've been struggling with that. The profile used to be all in English. And then when you go to some countries, you try to present, you try to, people, they don't see the need of really even listening or maybe trying to even understand what is inside. And I think now they are very detailed, and we give the opportunity for some countries to really get to understand what is there and try to see how that could be promoted. And also the point that Elga made at the beginning, you mentioned that also, Teresa, because all of this is about advocacy. We advocate for really better elements, health, and accountability, because countries have promised a lot, and you said, but it's important to track, to monitor, to see exactly how we are heading to those promises and try to reach those goals. And then the detail that we got on the equity profile, I know there's still work ongoing, probably to how to improve them. The ECD profile, I think this is all great. What we want to do is just to thank you so much for listening to this, and thank you really for challenging the countries, because now the bulk of the work should be now on the countries to make sure that the real stakeholders, they understand what it is and the action that should be taken to address the issues that are raised in this profile. And also the fact that the data are available. Teresa, you mentioned that for some profile, you could download the data and do whatever secondary analysis that you want to do, and try to also use it for fundraising, which is wonderful. So thank you so much for this such great work. I really want to hand it over to Thies Wapoppen. So thank you so much. And I think we are really excited. This is the countdown, and I know we are actually in a phase where countries are trying to devise a kind of the agenda, that's the countdown. But then you see that some of this work that we mentioned in the profile could be part of those agenda. And I think you would gain a lot into looking at those profiles, trying to see how they could be connected to the country agendas. But thank you so much. Thank you everyone for being here. Thank you, Jennifer and team, for organizing this such a wonderful webinar. Thank you all the ones who have been working on the logistics, the translators, the interpreters, those who really, the infographics. So thank you so much for this. And we look forward to engaging very soon into such a kind of webinar. Thank you so much and have a great day, evening or night, depending on where you are.
And thank you, PMNCH, for hosting it and Ilse for making it all happen. Thanks
Great.
a lot.
Thank you.